Option B, non-contact deceleration with planted foot. Option C, excessive rotational stress on the knee joint. Option D, sudden acceleration with eccentric overload. And the answer is option C, excessive rotational stress on the knee joint. Now let's move to question number 202. Which of the following muscle is primarily responsible for horizontal abduction of the shoulder joint? Option A, pectoralis major. Option B, latissimus dorsi. Option C, serratus anterior. Option D, teres minor. And the answer is option B, latissimus dorsi. Now let's move to question number 203. What is the recommended treatment for a complete tear of supraspinatus tendon? Option A, immobilization and non-weight bearing activities. Option B, aggressive rehabilitation exercises. Option C, surgical repair followed by rehabilitation. Option D, rise and activity modification. And the answer is option C, surgical repair followed by rehabilitation. Now let's move to question number 204. Which of the following exercise is recommended for improving dynamic stability and proprioception in athletes with functional angle instability? Option A, seated calf raise. Option B, leg press machine. Option C, single leg balance exercise on the unstable surface, example like Bosu board or verbal board. Option D, barbell squats. And the answer is option C, single leg balance exercise on the unstable surface. Now let's move to question number 205. What is the primary mechanism of injury in stress fracture of the navicular bone? Option A, direct trauma to the foot. Option B, repetitive overload with inadequate recovery. Option C, sudden deceleration with eccentric overload. Option D, excessive inversion and eversion of the foot. And the answer is option B, repetitive overload with inadequate recovery. Now let's move to question number 206. Which of the following condition is characterized by pain and tenderness around the ischial tuberosity and buttock region? Option A, ischiofemoral impingement. Option B, proximal hamstring tendinopathy. Option B, piriformis syndrome. Option D, adductor strain. And the answer is option C, piriformis syndrome. Now let's move to question number 207. Which of the following muscle is primarily responsible for inversion of the forearm? Option A, biceps brachii. Option B, brachioradialis. Option C, pronator teres. Option D, supinator. And the answer is option C, pronator teres. Now let's move to question number 208. Which of the following exercise is recommended for improving shoulder stability and control in overhead athletes? Option A, dumbbell biceps curls. Option B, lat pull downs, that's latissimus pull down. Option C, close kinematic chain exercise with external rotation, example like push up plus. Option D, seated dumbbell shoulder press. And the answer is option C, close kinetic chain exercise with external rotation. Now let's move to question number 209. What is the primary mechanism of injury in a medial collateral ligament sprain of the knee? Option A, direct trauma to the medial aspect of the knee. Option B, non-contact deceleration with the planted foot. Option C, excessive valgus stress on the knee joint. Option D, sudden acceleration with eccentric overload. And the answer is option C, excessive valgus stress on the knee joint. Now let's move to question number 210. Which of the following condition is characterized by pain and tenderness around the posterior aspect of the medial malleolus, that's inner angle bone? Option A, posterior tibialis tendinopathy. Option B, peroneal tendinopathy. Option C, anterior impingement syndrome. Option D, flexor hallucis longus tendinopathy. And the answer is option A, posterior tibialis tendinopathy. Now let's move to question number 211. Which of the following exercise is recommended for improving hip mobility and flexibility in athletes with femoroacetabular impingement, that's FAI? Option A, seated leg extension. Option B, prone hip extension exercises. Option C, dynamic stretching and firm rolling for the hip muscles. Option D, biceps curl. And the answer is option C, dynamic stretching and firm rolling for the hip muscles. Now let's move to question number 212. Which is the primary mechanism of injury in syndesmotic injury, that's high ankle sprain? Option A, excessive inversion of the ankle joint. Option B, excessive eversion of the ankle joint. Option C, excessive external rotation of the ankle joint. Option D, excessive internal rotation of the ankle joint. And the answer is option C, excessive external rotation of the ankle joint. Now let's move to question number 213. Which of the following condition is characterized by the pain and tenderness around the lateral aspect of the ankle joint? Option A, peroneal tendinopathy. Option B, posterior tibialis tendinopathy. Option C, flexor hallucis longus tendinopathy. Option D, anterior impingement syndrome. And the answer is option A, peroneal tendinopathy. Now let's move to question number 214. What is the primary mechanism of injury in lumbosacral disc herniation? Option A, direct trauma to the lower back region. Option B, repetitive flexion and rotation of the spine. Option C, sudden deceleration with eccentric overload. Option D, excessive inversion or eversion of the foot. And the answer is option B, repetitive flexion and rotation of the spine. Now let's move to question number 215. Which of the following exercise is recommended for improving core stability and control in athletes with low back pain? Option A, seated mission crunches. Option B, deadlifts. Option C, isometric abdominal bracing exercises. Option D, seated dumbbell shoulder press. And the answer is option C, isometric abdominal bracing exercises. Now let's move to question number 216. What is the primary mechanism of injury in a hamstring strain? Option A, direct trauma to the posterior thigh. Option B, excessive knee flexion with hip extension. Option C, sudden deceleration with eccentric overload. Option D, repetitive overuse without proper recovery. And the answer is option D, repetitive overuse without proper recovery. Now let's move to question number 217. Which of the following condition is characterized by pain and tenderness around the lateral aspect of the hip joint? Option A, trochanteric bursitis. Option B, iliotibial band syndrome. Option C, adductor strain. Option D, piriformis syndrome. And the answer is option B, iliotibial band syndrome. Now let's move to question number 218. Which of the following exercise is recommended for improving hip and pelvic stability in athletes with patellofemoral pain syndrome? Option A, seated leg extension. Option B, prone hip extension exercises. Option C, lateral step down with resistance. Option D, biceps curl. And the answer is option C, lateral step down with resistance. Now let's move to question number 219. Which of the following condition is characterized by pain and tenderness around the base of the fifth metatarsal bone? Option A, plantar fasciitis. Option B, Achilles tendinopathy. Option C, Jones fracture. Option D, metatarsalgia. And the answer is option C, Jones fracture. Now let's move to question number 220. Which of the following exercise is recommended for improving shoulder mobility and flexibility in overhead athletes? Option A, dumbbell biceps curl. Option B, lats pull down. Option C, dynamic stretching and foam rolling for the shoulder muscle. Option D, seated dumbbell shoulder presses. And the answer is option C, dynamic stretching and foam rolling for the shoulder muscles. So that's all for today. If you have any doubts, please do mention